The most rewarding aspects of me being a spine surgeon, as well as my training as an orthopedic surgeon, is the ability to take a patient whose life is extremely dysfunctional because of pain, because of the inability to even do normal daily activities, and return them to a normal life. And so the happiest thing I can see is a patient coming back from surgery and they have no pain, their life is back, and they're just the happiest people in the world. I started my spine training at the Mayo Clinic in Rochester, Minnesota, which was a fantastic place to learn spine surgery. I was able to not only work with orthopedic spine surgeons, but also neurosurgeons, and learned to incorporate both sets of techniques into my training. After I graduated the Mayo Clinic, I actually spent 5 years in the U.S. Air Force, not only doing general orthopedics, but spine surgery. And that allowed me to not only take care of a lot of complex patients, but also a lot of specialized patients, such as pilots, fighter pilots, special forces, Navy SEALs, people that needed to get recovered fast, and not always with surgery, a lot of times with non-surgical techniques, because surgery would put these high-end warriors down for months or even potentially their career. After I left the Air Force, I then went to the Chicago area and was at a major medical center where I was able to basically increase the training that I had by seeing more patients, but also with the advances in the technology. The hospital I was at was able to allow us to use the latest and greatest technology. So I was able to develop a lot of the skills that I practice today and employ them on these people, allowing them to recover faster, get back to work faster, and enjoy their lives faster. Minimally invasive surgery helps patients because by doing less muscle damage to the surrounding tissues, it allows the patients to actually recover faster. They still get the benefit of freeing the nerve up, getting rid of their nerve pain, their sciatica, their arm pain, but less surgical damage, so to speak, and so they can recover a lot faster. When I moved to Alaska, I anticipated there would be some changes in spine problems, and I was initially overwhelmed at the severity of spine problems in Alaska. It seems like in Alaska, patients wait a lot longer, and when they come in for surgery, they actually need a bigger surgery, but they recover so much better because they'll have this willpower to get better. And they have to get better because they have to go hunting, they have to go fishing, they have to cut wood to provide heat. They like living on the land, they like being outdoors. And so it's just actually more rewarding in Alaska because you return people to a better way of life.